Hello everyone, I'm Sarah Richardson. I'm 19 years old and I live with diffuse TGCT in my left knee. Living with this rare condition has shaped much of my life for the past several years. Navigating appointments, surgeries, physical therapy, and the uncertainty that comes with TGCT has not always been easy. There are moments when I questioned what my future would look like and wondered how this diagnosis would impact the life I'd imagined for myself. My journey began at 16, when my left knee suddenly became extremely swollen, stiff, and difficult to move. The pain was intense, a deep stabbing sensation combined with pressure from the swelling, and soon I could no longer walk independently. But the hardest part wasn't just the pain. It was the fear of not knowing what was happening to my body. The search for answers took about a month, though it felt much longer. It started in January 2023 with an after-hours orthopedic sports visit. My knee was drained at that appointment, but the sample was not tested, as the physician did not feel it was necessary, assuming that it was just an injury. I saw multiple doctors and specialists over the next month, and several possible diagnoses were mentioned: rheumatoid arthritis, lupus, even leukemia. Despite all the visits, no one could explain what was happening. That changed when my pediatrician referred me to Dr. Davis in pediatric rheumatology at Vanderbilt. She listened, ordered tests, drained my knee again, and importantly, tested the sample. She mentioned a rare condition called PVNS and said, "This may not be it, but I have a feeling it could be." For the first time, I felt hope. I was referred to an orthopedic surgeon, even though I had requested an orthopedic oncologist. I was told that it was unnecessary to see an oncologist because the diagnosis was not malignant cancer. I had surgery in February 2023 to remove the tumors, but recovery was extremely slow. I never felt full relief and the swelling and pain continued. When I reached out to my surgeon, my concerns were dismissed. I was told I should be walking fine and that nothing was wrong. I was made to feel as though I was exaggerating. I continued physical therapy, but mobility remained difficult. My initial physical therapist had not even heard of TGCT. My mom refused to accept this as my new normal. She reached out to anyone who might help and found Dr. Sydney Stern and the TGCT support group on Facebook. Dr. Stern recommended a few specialists at Vanderbilt, and my mom immediately began making calls. She reached out to Dr. Vicky Keaty's office, but because I was a pediatric patient, she recommended Dr. Scott Bornstein at Vanderbilt Pediatric Oncology. And from that moment forward, everything changed. Dr. Bornstein met with me and referred me to Dr. Jennifer Halpern, an orthopedic oncologist. From the beginning, they explained that this journey would take time, a marathon, not a sprint. They didn't just focus on scans or treatment plans. They cared about my fears, my mental health, and how my family was coping. Dr. Bornstein even helped me connect with a psychologist so I could better process everything. They treated me like family, not just a chart. I was a teenager trying to navigate a rare disease, and they understood that. Unfortunately, they discovered that I needed another surgery exactly 12 months after my first. This time, the outcome was very different. Dr. Halpern referred me to Dr. Charles Cox for a synovectomy and tumor removal in February 2024. He also found a torn meniscus, likely from overcompensating while walking. I started physical therapy within a week with Kevin Hovde at Empower Physical Therapy. Kevin helped me build more than just my physical strength. He rebuilt my confidence. He pushed me in ways that reminded me I could work toward a meaningful life after TGCT. Throughout this process, Dr. Sydney Stern played a huge role in my success. She provided emotional support, reassurance, and helped me understand TGCT. Her knowledge and resource made a tremendous difference. I share these details because they highlight the importance of receiving care from professionals who truly understand TGCT and the impact it has on patients. Physically, TGCT changed my life overnight. One day I could walk independently, and the next I needed help from my parents or crutches. I always joke that crutches seem interesting when you're a kid, until you actually need them. They're not as fun as they look, although they do build some upper body strength. But behind the humor was a harder reality. I had just started driving my first car, and suddenly I couldn't drive or walk independently. I lost a level of independence I had only just begun to gain. For a period of time, I relied on a wheelchair, walker, or crutches. Simple things like walking into school or carrying my backpack became extreme challenges. The emotional impact of TGCT is not always visible. People see surgeries and appointments, but they don't see the fears that follow you every single day. Questions like, will it come back, or will I need another surgery, always live in the back of my mind. Every pain around my knee terrifies me. As a teenager, those are not the things I should be worrying about. While my peers focus on school events and friendships, I focus on recovery and trying to understand a disease very few people know about. Much of my struggle is invisible. Some days I look fine, but inside I'm dealing with pain, anxiety, fatigue, and uncertainty. TGCT affects every part of my life: my education, my social life, my relationships, and my sense of normalcy. I learned that a disease like TGCT doesn't just affect one part of a person's life, it creates this ripple effect. This is why compassionate, knowledgeable healthcare matters so much. Dr. Halpern, Dr. Bornstein, Dr. Cox, Dr. Stern, and Kevin Hoopty are vital to the TGCT community. They didn't talk down to me, they talked with me. They walked alongside me through one of the most difficult chapters of my life. Because of them, I discovered my own purpose. Watching my healthcare team care for me and my family showed me the impact one person can have on another's life. Their compassion inspired me to pursue a career in the medical field. I want to give others the same feeling they gave me, the feeling that someone is listening, someone cares, and someone believes in them. Today, TGCT is part of my story, but it does not define my story. My hope is that when you care for patients with TGCT or any rare disease, you remember that behind every person is a diagnosis, that every diagnosis is a person with fears, dreams, relationships, and a future they're trying to protect.